Everyone. So today we will continue with the MCQ discussion which we had started yesterday. So we have around 70 more questions to cover, and we'll be discussing answers. I expect you all to answer in the chat box whenever the questions are there. So we move on to the first question. Under eradication of congenital rubella syndrome program, the first priority group for rubella vaccination is option E, all non-pregnant women of age 15 to 34, all adolescent non-pregnant girls from 15 to 24 years of age, all female children at 1 year, or option D, all non-pregnant women. Which is the right answer? Please answer the chat box. I'll be waiting. Among the given option, who is given the first priority? Now these are giving answers as option A. So, according to the congenital rubella syndrome program, there are three priorities. Three priorities are given by the under the program. So the first priority, as you all have said correctly, it is A. First priority is given to all non-pregnant women of age 15 to 34. These people are given first priority. That is, age 15 to 34 means a woman in the childbearing age. Childbearing age. So they are given the first priority. And the second priority is children of 1 to 14 years. Children of 1 to 14 years are given the second priority. And the third priority is children at 1 year of age. Children of 1 year of age is given the third priority. So first priority is all non-pregnant women of age 15 to 30. As you people are. We move on to the second question. Which of the following vaccine is not included under EPI schedule? Is it DPT or MMR or BCG or OPV? Which of the following vaccine is not included under EPI schedule? Please answer the chat box. I am waiting. So for this, you need to know what is EPI schedule, that is expanded program for immunization, program for immunization, and what are the vaccines that come under that. Those are the basic vaccines, that is BCG, OPV, hepatitis B, then the pentavalent vaccine, then measles vaccine, then Japanese encephalitis, DPT, and TT. These are the basic vaccines which come under EPI schedule. Other than that, vitamin A and rotavirus has also been added now. These are the vaccines which come under EPI schedule. So, among these, MMR is the right answer, as some of you have already said correctly. MMR is the one which is not included under the EPI schedule. Measles is included, but MMR is not included. Mumps and rubella is not included. Moving on to the next question. An example of a secondary healthcare level would be, which is a secondary healthcare among the following options: primary health center, sub-center, community health center, or apex health institutions. Which among this are the secondary health centers? Please answer. I have already started getting the answers as answer differently. So the right answer here, as some of you have said, it is community health center. This community health center is the one which comes under secondary health care level. So primary, as the name says, comes under the primary health center. And then comes up community health center, then the private, then the district hospital, and then the major specialty hospitals. This is the right answer. It comes under the secondary health care. Now, moving on to the next one. Which of the following is not a function of primary health center in India? Which is not a function of primary health center? Medical care, safe water supply, collection of vital statistics, or supplementary functioning of under 6 children. Which is not the right answer in this one. Which is the right answer in this one? This answer. Many of you answered as B. The function of primary health center is in the textbook of PAR. It is provision of medical care. Yeah, medical care is a function of PHC. Then maternal and child health, family planning, those things. That also comes under the function of PHCs. Then comes the safe water supply. Yeah, the safe water supply is a function of PHC. That is not the right answer. Then the collection and reporting of the wide statistics. That is also a function of primary health center. But the supplementary functioning under 6 children, that is not under the function of primary health center. That comes under the ICDS scheme. That is not directly under the function of primary health center. So here the right answer is D. D is the right answer here. D. Okay. So other than that, the other functions are national health programs, other national health programs, whichever is relevant in that area. Then education, health education, then referral services, then training of these health guides and local guides and health assistant, and the basic laboratory works. Those are the functions of primary health center. So the correct answer here is D. Moving on, all are grassroots level worker except options are Anganwadi worker, village health assistant, DAI, or health assistant, who is not a grassroots level worker. This was also dealt with it when the theory was being taken about the grassroots level workers and about these health assistant, DAIs, and Anganwadi workers. So, which is the right answer here? It is very confusing. Yes, it is kind of confusing because it is a kind of dry subject, and most of the things we think that we may not need in a future practice, but still we need to learn. And if you look at that, in the present situation, community medicine becomes important when such an epidemic is prevalent in the country, and a pandemic is prevalent in the world. Some things are important and some things not so important. But still, we have to study it for the entrance and exams. Yeah. Is the right answer? Some of you have answered correctly. The answer here is health assistant. Health assistant is the one who is not a grassroots level worker. Who is a grassroots level worker? Who directly interacts with the public, man-to-man education and the interactions there. Those people are the grassroots level worker. Who else is a grassroots level worker? Anganwadi worker is a grassroots level worker. Village health assistant also comes under the grassroots. DAI also comes under grassroots level. Other than that, the ANMs means the auxiliary nurse midwives. Auxiliary nurse midwives, that is the DAI, local DAIs and these people. And ASHAs, they also come under the grassroots level worker. So here, 4 is the answer. Now moving on to the next question. Which of the following is a set point frame for a long-term plan but is yet something that cannot be quantified or measured? So remember, this is the definition of one of the following option, which we studied, the statistics and planning portion. So such questions can also be asked. So which is the right answer? So the following is a set point frame for a long-term plan, but yet something that cannot be quantified or measured. So the one which cannot be measured and it's a set point. This is the right answer here. I'm getting answers like B. Yeah, exactly. Goal is the right answer. Goal is the one which is a set point. It is one point, and goal cannot be measured or quantified. The mission is a process, not a point. Now moving on to the next one. Mission is a process, not a set point. Goal is the answer. Moving on. Match the following names of health committees in India. Such match the following questions are very much common nowadays from the last exams onwards. Which is the right answer here? Match the following names of health committees in India to the programs which was or statistics which was established. So yesterday while dealing with the MCQs, I had slightly told about these things, about each of the committees. I had just told about it. It will be easier for you if you know at least 2 of the answers. The board committee. Board committee has what? Is it health survey and development or the multi-purpose worker scheme or committee of integration of health services or health survey and planning committee, which is the one for board committee. And next one is Modular. Modular has which of them? Please read and then answer. Now start getting answers like B. Okay. Board committee has told about health survey. Board committee and Modular both have told about health survey. But board committee has said about development. Development comes with the board committee and planning is what Modular committee told. So we got 2 of them. A has 1 and B is 4. A1 and B4. Which among this has A1 and B4? B and C has that option. So we need to see one more thing. Jungle Committee. Jungle Committee has told about integration of health services. This is told by Jungle Committee. The last one is Kartar Singh Committee, which was dealt with it yesterday. So Jungle Committee has told about multi-purpose worker scheme. That is true. So which is the right answer? 1432. 1432. B is the right answer here. At least some of you have answered it correctly. Vandana, Dr. Shilpa. Well done. So moving on to the next question. So B is the right answer here. Next one. Planning cycle. Planning cycle includes what? Analysis, evaluation, resource, or all of the above. This is the right answer. This is the right answer among this one? Planning cycle includes which of the following? Analysis of the situation, evaluation, resource assessment, or all of them. Please answer in the chat box. It's a very easy one because planning, when we generally use planning, we will have a set of points. So I have started getting answers like D. Exactly, D is the answer because all of these things come under planning, analysis, then evaluation, resource assessment also comes under planning. So first in planning, we have analysis. Analyze things, then set up a goal, then we find out whatever resources we have, then we see about our priorities. We set up the priorities, then we formulate, that is write up whatever we are supposed to do and all those things. Then program the things whichever we do, whichever goal we have. So program how to reach that goal. So after program and then we monitor if the things are going properly or not. Then we evaluate. Then we evaluate the result and then finally we again analyze. So this is the planning cycle. Let's see here analysis also. Analysis came under here. Evaluation that also came. Source assessment that also came. So here 4 is the right answer. D is the right answer. All of you have correctly said correctly the answer. Next, moving on. Eligible couple register is maintained at which of the following? Sub-center, PHC, CHC, or district headquarters? Where is the eligible couple register maintained? Please answer. I've got answer like so to answer this, we need to know what is eligible couple. Before going into that, we'll see what is eligible couple. So eligible couple is any newly married couple where the wife is in the reproductive age. If the wife is under the reproductive age, that is 45 years. Then any couple whose wife is in that age group, they are eligible couple. And there is one more term we know, it is target couple. Target couple is those couples who have at least 2 to 3 living children. Some books there might be slightly different. Yeah, 2 to 3 living children. Any couple who are having such children as target couple. So the answers which I've got is PHC, CHC, subcenter, etc. So the right answer here is subcenter. This register for eligible couples are maintained at subcenter, not in PHC or CHC, maintained in the subcenter. Okay. So yeah, some of you have answered correctly, Dr. Anu have answered correctly. So moving on to the next question. Disability limitation is a mode of intervention for primary prevention, primary, secondary, or tertiary. So where is this disability limitation comes under? Which one of the following? Primary, primordial, secondary, or tertiary? This is a very basic question and can be expected most of the times. Either directly they will ask which comes under what, or else they can even ask some of the examples for it. So just make sure you read about this before going for the exam. So please answer. Disability limitation comes under what? Yeah, exactly. I got the answer already. Disability limitation comes under tertiary prevention. One more thing comes under disability under tertiary prevention, that is rehabilitation. Rehabilitation also comes under tertiary prevention. No? Every one of you answered very much correctly. Other than that, primordial prevention has health education. Then primary prevention has health promotion and specific protection. And secondary prevention has early diagnosis and treatment. Just remember that. Health education, health promotion and specific protection. Then diagnosis and treatment in the secondary one, and tertiary has disability limitation and rehabilitation. Now moving on to the next one. Which of the following is the most logical sequence? Which is the correct sequence here? Yesterday also I had told about the same sequence, and when theory was told, each of the sequence and the definition was also taught. So which is the correct sequence here? Please answer. It is very much easy. Disease, impairment, disability, handicap, or disease, impairment, handicap, disability, or impairment, disease, disability, handicap, or disease, handicap, impairment, disability. This is the right answer here. Exactly. You have already answered it correctly. First, disease occurs, then impairment occurs, then because of impairment, the person is not able to do. That is disability. And because of that, he is rendered as handicap. So, B is the correct answer here. Correct answer is B. The correctly answered. So, moving on to the next question. I don't have to explain much in this one. Next one. Pap smear test for detection of carcinoma of cervix is under which level of prevention? On the earlier question, I had told that such examples can also be asked. So, pap smear test comes under which level of prevention? Is it primary, primordial, secondary, or tertiary? This is the right answer here. Pap smear test, which is done for detection of CA cervix. That comes under which level of prevention? Is it primordial, primary, secondary, or tertiary? Yeah, all of you answered very much correctly. It comes under secondary. Why? With pap smear, we do diagnosis. So early diagnosis is done by pap smear test. Secondary is the correct answer. It's the early diagnosis. Early diagnosis. Now, moving on to the next question. Immunization. Immunization is which kind of prevention? Primary, secondary, tertiary, or disabilities? I have mentioned such questions repeatedly because one question is very much sure from this portion, and it can be the examples or directly, even directly they can be asked. So immunization is which kind of prevention? Primary, secondary, tertiary, or disability limitation? Which is immunization? Which is a kind of immunization? So with immunization, what do we do? Protect. With vaccination, we protect the people from a certain kind of disease. So certain kind of disease, that is specific. Immunization is always specific, and what do we do? We protect. So immunization is coming under primary prevention because we already have dealt in the earlier question that primary prevention has two parts: promotion, health promotion, and specific protection. Health promotion and specific protection. The right answer, as you all have said, it is primary prevention. Moving on, next question. Example for disability limitation. Again, similar question. Example for disability limitation is odds, quitting smoking, or BCG vaccination, or spectacles for refractory error. Which is the right answer among this one? It is a kind of disability limitation. Is it DOTS therapy, or quitting the smoking, or vaccination, spectacles for refractory error? This is the right answer. DOTS is all we all know. DOTS is what treatment for TB. So it is treatment. Early diagnosis and treatment comes under secondary. It's not a disability. Quitting smoking, it is a kind of health promotion. This comes under primary. BCG vaccination, immunization, the previous question we learned, BCG vaccination comes under primary. Now, spectacles for refractory error. Already the person has a refractory error, and using spectacles will stop the progression of the whichever error is there. So, this is a kind of visibility limitation. As you all have correctly answered here, 4 is the right answer. Spectacles for refractory error is a kind of visibility limitation. Now, we move on to the next question. Milk is a good source of all the vitamins except among the following which is not present in immense amount in milk. Vitamin A, B, C or D. Which is not present in the milk? Vitamin A, B, C or D. Which answer is that was? I started getting answers like C and majority are telling C. Exactly, vitamin C. Vitamin C is not present in milk. The quantity of vitamin C in milk is 0. So C is the right answer. Vitamin D is present. B and A is also found in milk, but C is 0. So C is the right answer here. Moving on to the next question. Some of you have told as B in this question. Vitamin D is present in milk, even though it is one international unit. One international unit of vitamin D is present in milk per 100 ml. Per 100 ml. It is found in milk, but vitamin C is 0. That is why C is the right answer here. Moving on to the next question. Consider the following milk-borne diseases: brucellosis, listeriosis, salmonellosis. Among these three, which can be controlled by pasteurization? Option A, 1 and B, option B, 2 and 3, option 3, option C, 3, option D, 1, 2, and 3. Which of the following, which of the following diseases like brucellosis, listeriosis, and salmonellosis can be controlled by pasteurization? Right answer here. This kind of question was introduced in the AIAPGET from last year onwards. So there's a high chance that this year also they may ask this kind of questions. Have a go through on such questions. Because such questions has been asked in PSCs and other PG exams. So I'm getting answers like A, B, C. It's a mixture of questions. Right answer here is D. All the three can be controlled by pasteurization. Okay. All the three pathogenic agents can be killed by pasteurization. So D is the right answer. Yeah, Dr. Akilesh, Dr. Yeah, I also has correctly answered the answer, that is D. Moving on to the next question. Again, and as the following. In this, please match this one to list. This one to list. First one, papaya fruit. That means ragi amla fruit. The other one has calcium, vitamin C, protein, and vitamin A. The right answer here. Carefully check and answer. Please match the following. The basic thing is at least you need to know two of the correct answer. Then it will be easier for you to use the options. All these are getting answers. Let's see. Papaya fruit. No, papaya fruit is. This is also vitamin A. Soya beans, we know it is a source of proteins. Ragi is the source of calcium. It's a rich source of calcium. And amla, we have been learning it is a rich source of vitamin C. So papaya has four. One A, 4, B, 3, C, 1, and B, so 4, 3, 1, 2. 4, 3, 1, 2. C is the correct answer here. If you are correctly answered, if all of you are correctly answered here, C is the right answer. Remember to go over the sources of the vitamins and the minerals before the exams. It's important. The community medicine part also, and even the medicine part. Moving on to the next question. It's a great question. Which contains the maximum calcium? Among the following, which contains the maximum? Just in the previous question, we dealt with this. This answer is very much easy to answer. Which is the among this thing which has the maximum amount of calcium? I have already got the answer. Ragi. Ragi is the maximum, which is also calcium among the three. So ragi is the right answer. C is the right answer. All of you are correctly answered. Now moving on to the next question. Boa. We all know what boa is. I will have to explain it again. Boa is a toxin responsible for epidemic dropsy, neuroatherism, endemic ascites, or fluorosis. Such simple and direct questions are also being asked. You don't have to worry. One or the other way, you will answer the questions coming from the community medicine. So, Boa is a toxin responsible for what? Is it epidemic dropsy? Is it neuroatherism? Is it endemic ascites or is it fluorosis? All these are getting the answers as to neuroatherism exactly. Boa, that is beta oxaloaminoalanine is a toxin responsible for neuroatherism. Okay. C is a sorry. 2 is the right answer, as you all have correctly answered. We move on to the next question. Yeah. Ergotism is due to the toxic alkaloid produced by which fungus? It's a trichophyton, Clariceps purpurea, Fusarium species, or Absidia. Which is the right answer here? Questions from this adulteration and food adulteration, food fortification, and the diseases is very much important. To know the right, you need to know which toxin is responsible for what and which adulteration is responsible for what kind of diseases. The right answer here, exactly, you have already answered. As to Claviceps purpurea is the right answer. Ergotism is because of this fungus, Claviceps purpurea. 2 is the right answer, as you all have correctly answered. Moving on to the next question. Endemic ascites is caused by what? Arjuna mexicana seed, kesari dal, ginginia seed, ergot poisoning, or aspergillus flavus. This is the one which is responsible for endemic ascites. In the adulteration part, we have studied about some of the diseases like epidemic dropsy, endemic ascites, atherism, ergotism, aflatoxins. Among this, endemic ascites is a question here, and it is caused by what? It is caused by the adulteration of what? It is caused due to getting the next answers. So here we know kesari dal is the cause for bacterialism. Kesari dal has the boa toxin. This is not the right answer. Some of you answered as B, but B is not the right answer. And then Argemone mexicana seed. Argemone mexicana seed is also not the answer because this causes epidemic dropsy. It causes epidemic dropsy. Ergot poisoning? No, ergotism. Taxislopedia. Aspergillus fungus, this has the aflatoxin. Aflatoxin, which is responsible for hepato- hepatocellular carcinoma, that's liver cancer. Now, Junjunia seeds. Junjunia seeds is the right answer for endemic ascites. So C is the right answer. Okay, C is the correct answer here. Now, moving on. Next question. Junjunia seed is otherwise called as crotalaria. Remember, crotalaria. And give the option as crotalaria seeds. Moving on to the next question. All are the examples of food fortification except hydration of salt, vitamin A in vanaspati, fluoridation of water, or saffron color in milk, which is not an example for food fortification. That's the question here. It's a hydration of salt, vitamin A in vanaspati, fluoridation of water, or saffron color in milk, which is not an example for food fortification. Not an example. Remember, this asked is not an example. Except, remember to double check the question before answering. I'm getting answers like D. Yeah. The correct answer is exactly D is the right answer. You know, other things. Fortification means what? Something which can enhance, adding something to the food which can enhance the nutritional ability of the food. So, hydration salt is it enhances the food, does not destroy. And vitamin A also enhances fluoridation of water, also enhances the water quality. But saffron color in milk, it does not have much effect on the food. B is the right answer here, as you all have correctly answered. Now moving on to the next question. Then we have some more questions remaining. Now moving on. Nalgonda technique is used for what? Fluoridation of water, defluoridation of water, iodization of salt, or detoxification of contaminated mustard oil, which is the right answer here. And where is Nalgonda technique used? Nalgonda technique. Where is it used? Yesterday we had dealt with the portion of this. Exactly, we are already started getting answers as defluoridation. Defluoridation is the right answer. Fluorination, there is a method called double pot method. Double pot method, fluorination of wells. Defluoridation has this Nalgonda technique. It was introduced in the setup. Now, moving on to the next question. Consider the following statements. So, this kind of question was used again last year from in AIAPGet. The PhD exams and another PG exams previously, this kind of questions used to come. Now, we have two statements here. We have to see which is the correct one. First statement, in food preservation by irradiation and ionizing rays are used. In food preservation by irradiation, ionizing rays are used. Second statement, irradiation does not affect the color, odor, pH, taste, and levels of vitamin content in the food. Which is the right answer? Which among the statement is true? Are both of them true? Or neither of them are true? But A, this is the correct one. So I'm getting answers like B, that nothing, I mean, neither of them are true. So here, yeah, I'm getting mixed answers. In food preservation by irradiation, ionizing rays are used. That is true. That is entirely true. But the second statement that irradiation does not affect the color, odor, taste, pH, and levels of vitamin contents in food. That is wrong. That is wrong. Aeration does affect the other physical characteristics, chemical or physical characteristics of the food. Remember for this one. In this question, A is the right answer. A is the only student which is correct. So, one is answer correct. A is the right answer here. Now moving on to the next question. A patient has microcytic anemia. So here the patient has microcytic anemia. The least likely diagnosis is iron deficiency, thalassemia, sideroblastic anemia, or vitamin B12 deficiency. This is the right answer. This is very much easy question. You can easily answer. Which is the least likely diagnosis for this one? Microcytic anemia. For this, you need to know a bit of medicine. This medicine or pathology. I think it was taught in the pathology session. The types of anemia and the types of microcytic anemia. So I'm getting answers as D, which is exactly the right answer. D is the right answer because vitamin B12 deficiency gives us what kind of anemia? It gives us megaloblasts. So, many of you answered very much correctly. Now, moving on to the next question. Biodegradable waste products disposing of in which color of the which of the color code of price? This was also dealt yesterday. Remember the color coding of the waste? Biodegradable waste is disposed of in which color code? Blue, black, green, or we all know in the color coding of waste products, we don't have a color green on it. So green cannot be the answer. And black, we said yesterday it is, and it has a cytotoxic drugs and chemicals. Blue has a glass products. There is no color green. D has a non-analytical waste and all the biodegradable waste products. So D is the right answer. D is the right answer here. Okay. Yellow is the right answer. Now moving on to the next question. Black color in triage. So this was taught in the theory portions, Triad System. The disaster management chapter, we study about this one. In Triad System, what does black color mean? Like how we have traffic lights, we have three colors and one more color, that is a black color in the Triad System. What does black color mean? Is it death, transfer, high priority or low priority? This is the right answer. Already getting the answers as death, exactly. Black means death. The triad system, black means you might have been posted in the casualty, and there we see this triad system. Other colors are green, yellow, and red. Red means high priority. Highest is the red. That is the highest priority. Yellow means low, not low priority, medium priority, where the patient can remain alive without assistance for some more time. Green means ambulatory patient, low priority. The least priority is the black. Solid. Now, moving on to the next one. As per the most common classification of triad system, that is internationally accepted, the color code that indicates a high priority treatment or transfer is black, yellow, red, or blue. Right answer here. Just now I told about this one. High priority. Some questions will be like we have a lengthy question in the exam, but there will be only 2 or 3 entry points that which we need to know. The entry point is triad system and high priority, which is the color which indicates high priority in the triad system. That is the question here. Just now I told exactly red is the high priority. In the triad system, red is the high priority. When it comes to yellow, there is no color blue. The triad system. Some places it is there. Similar to green. Red is the high priority system. Next one, moving on to the next question. Who about triage? Again, same similar question. I have kept it repeatedly because this is one of the important ones. Please see the question and answer. Yellow least priority, red morbidity, green ambulatory, or blue ambulatory. Which is true about this one? Let's start getting answers. The right answer here is C. C is the right answer. Yes, some of you have answered correctly. Many of you have answered correctly. C is the right answer. Green means ambulatory. Morbidity. Morbidity is not red. Red means the highest priority and the patient needs immediate assistance. Yellow is not least priority. Green is least priority. Green or red, sorry, not red, black is the least priority. Okay. Green is the ambulatory patient. That is the correct option here. Moving on to the next question. Yeah. Which of the following research method studies have only people who are intentionally free of disease of interest? Or initially free of the disease of interest. Which is the right answer here? Case control study, case series study, prevalence survey, or cohort study. Among the following options, where are the subjects initially free of disease? Where do we start with the people who are not diseased? That is what the question is. In some studies, in one of these studies, we use people who are not having any kind of disease. The study starts. What the question is, which of the following research method studies have only people who are initially free of the disease of interest? So here, if I have to say, in case control study, we have cases and controls. Cases means the people are having disease. Case series study, again, we have cases, which means the patient is having disease. Prevalence survey. Prevalence means it is a survey. So prevalence means we see if these people are having disease or not. In all these three, we have people who are having some other kind of diseases. But here in cohort study, we take people who are free of disease. We take two groups, that is exposed and non-exposed group. Exposed and non-exposed group who do not have any symptoms. Means the disease has not yet started on the people. The right answer here, as some of you have correctly said, it is cohort study. Dr. Akhilesh, Dr. Ansina, Dr. Jumana has correctly answered. It is D. Cohort study is the right answer here. Okay. Cohort study, first we take the people who are not having any kind of diseases. That is all. Moving on to the next question. Again, the indexes, which I had explained it yesterday. All of the following indicators are used to measure disability rates in the community, except the Sullivan's Index, is it Human Poverty Index, this Health Adjusted Life Expectancy, or disability adjusted life rate. This is the one which does not indicate any disability, it's not disability rate. So for this, you need to know what is Sullivan's index, what is human poverty index, what is health adjusted life expectancy, what is disability adjusted short form is. Now start getting answers like A. See the answer. The question was about just all of the following indicators are used to measure disability rates in the community except. Remember this except, which is not useful in the disability rate. Sullivan's index. What is Sullivan's index? Sullivan's index is the disability free life expectancy. Yes, disability free life expectancy. Okay, so there is a term only like disability. So it has a disability rate included in the formula. Okay, so A is not the answer. Some of you answered it as A. A is not the answer. Health adjusted life expectancy. So here, while calculating health adjusted life expectancy, we need to know the disability years or disability days of a person. So, health adjusted life expectancy is also not the right answer. And disability adjusted life year, as the name only suggests, it is not the answer because it is a kind of disability. But human poverty index is in no way related to disability rate. Okay? Index of the poverty, not the disability. So here the income comes, the life expectancy comes, then the basic literacy rate comes. But disability does not come under human poverty index. Okay. B is the right answer here. Some of you have answered correctly. B is the right answer. Moving on to the next question. Silent epidemic of the century. Which is the silent epidemic of the century? Is it coronary artery disease? Is it chronic liver disease? Is it COPD or Alzheimer's disease? Which is the silent epidemic of this century? Please answer in the chat box. That means all of you have correctly answered. The silent epidemic of this century is Alzheimer's. Alzheimer's is on that title of silent epidemic. So, moving on to the next question. Epidemiological triad is all included except which is not included in the epidemiological triad. That is a question. Host, environmental factors, agent, or investigator. It does not come under epidemiological triad. Epidemiological triad and epidemiological triangle is different. There is a slight difference in that. Remember, we can ask about epidemiological triangle also. You just have to know which. I have already started the answers. As B, exactly B is the right answer. Epidemiological triad does not have investigator. B is the right answer. What is epidemiological triad? It has agent, host, and environment. And in epidemiological triangle, this one is a triangle. Okay? In epidemiological triangle, there is one more thing. The same agent, host, and environment does come. With that, one more thing comes in epidemiological triangle. It is the time. This is a triangle and this is a triangle. You just have to know. Investigator does not come in either of them. Moving on to the next question. All are true statement regarding BCG vaccination except which is not true in the given question, given statements. BCG vaccination is given subcutaneously. Can it be given in tubercular negative patients? It prevents the hematogenous spread or it is prepared from Mycobacterium bovis. The right answer here. Please answer the chat box. So answer getting answers. Given subcutaneously, exactly. So which is the correct route for BCG vaccination? You can answer that also in the chat box. That time I will just explain the other things about BCG vaccination. Exactly, you have already answered correctly. A is the right answer. It is not given subcutaneously. So what is the route of administration of BCG? Please answer. What is the route of administration of BCG vaccine? So you all need to know that BCG vaccination is available in powder form. Okay, dried powder like form it is seen, it is given. And also one more thing, before administrating, it is mixed with normal saline. Remember, it is normal saline, not distilled water. You can ask that. Then other than that, the viral site of injection, it is the insertion of deltoid. Insertion of deltoid. Yeah, all of you are answering correctly. The BCG vaccination is given intradermally. It is intradermal vaccination. All the statements are true. It prevents the hematogenous spread. It is prepared from Mycobacterium bovis and can be given in tubercular. The interesting thing about BCG vaccination is that why it is not given in distilled water. Because in distilled water, if we mix the vaccine in distilled water and give, then because the vaccine is intradermal injection, it can irritate the dermis. Distilled water is basically a the dermis. It is given intradermal. Now moving on to the next question. The vaccine administered as nose drops. Which vaccine is given as nasal drops? Is it rubella? Is it polio? Is it influenza? Or is it measles? Which is a nose drop? Which vaccine is given as nasal drops? Rubella, polio, influenza, or measles? Answer. If you're answering it correctly, it is exactly influenza is the one which is given as nasal drops. Nasal spray can also be given, but nasal drops is given. Other things like poliomyelitis, it is given oral. It is oral polio vaccine. OPV or IPV. IPV is injected and OPV is given orally, not nasally. That is why B cannot be the answer here. Measles, it is given. So the right answer here is C. Okay, moving on to the next question. All are killed vaccines except this is not a killed vaccine here. Answer is it measles, hepatitis B, plague, or diphtheria? Which is not a killed vaccine. Remember to double check the question for the term expected. Except. Here, remember in this question there are two answers. Okay, there are two answers. you think properly, there can be two answers. As I are getting answers as A, exactly A is the right answer. A is exactly the right answer because measles is a live vaccine. Okay. Hepatitis B, plague, these two are killed vaccine. And what is diphtheria? How is diphtheria vaccine given? Is it a killed vaccine or a live vaccine? This answer? Yeah, exactly. D also. Why D also comes? D comes because diphtheria is a toxoid. Diphtheria is basically a toxoid. A and D is the answer. Diphtheria is also the right answer. A and D is the right answer here. Now, moving on to the next question. An example for space spray is pyrethrun, malathion, DDT or Paris green. Which is the right answer here? Which is a space spray? Which is a space spray here? Pyrethrun, malathion, DDT or Paris green? Please answer. Now I'm getting answers as A. Exactly, A is the right answer. Pyrethrun is the space spray. Basically, it is a kind of indoor spray. Okay? Kind of indoor spray. And one thing you may get confused about malathion. One kind of malathion can also be used as a spray. That's an outdoor spray, not indoor. Outdoor spray. But if such questions comes, you have to select the app most appropriate one. Okay? That is why A is the right answer here. Moving on to the next question. Culex mosquito is associated with transmission of typhus, dengue fever, or Japanese encephalitis. This is the right answer. Very much easy question. Yesterday, almost 10 questions were dealt with the vector chapter. So here, Culex mosquito is associated with transmission of what? Malaria, typhus, dengue, or Japanese encephalitis. Which is the right answer? Exactly, all of you are answering very correctly. The Japanese encephalitis. So B is the right answer. Now, if you see about the other things, malaria, we all know it is from the vector Anopheles mosquito. Anopheles mosquito. Human Anopheles mosquito. Typhus, I had told about it yesterday. Typhus, strep typhus is by mite. It can be mite. It can endemic typhus is by flea. The epidemic typhus is by lice. And tick typhus is by tick. That is, and dengue fever, we all know it is Aedes mosquito. So the right answer here is Japanese encephalitis. Moving on, next question, DDT. This I had told about it while dealing with the insecticides yesterday. One of the questions I had answered. DDT is what? Organochlorine compound, organophosphorus compound, carbamide, or stomach poison. This is the right answer here. DDT is organochlorine or organophosphorus or carbamide or stomach poison. You have to select the most appropriate answer. Remember, choosing the most appropriate answer. Okay. So, if you know the full form of DDT, it is very much easy for you to answer this one. What is the full form of DDT? It is dichloro, diphenyl, trichloro. From the name only, you have to answer this one. DDT is an organochlorine compound. It's an organochlorine compound. And it's not a stomach poison. Though in honeybees, except for in honeybees, it is a stomach poison. Other than that, basically, DDT is considered to be contact poison. Contact poison. The right answer here is organochlorine compound. A is the right answer. Some of you answered very correctly. Now moving on to the next question. Copper tea is preferably inserted postnatal after postnatal period. When is the copper tea inserted? 2 weeks, 4 weeks, 5 weeks, or 8 weeks? Is the copper tea inserted? This answer 2 weeks, 4 weeks, 5 weeks, or 8 weeks. When is the copper tea inserted in the postnatal period? Postnatal period. They are telling me the right answer is 8 weeks. After in the postnatal period, the preferred time is after 8 weeks. D is the right answer. Okay, D is the correct answer. Adish has correctly answered. D is the correct option here. Remember, don't forget it. Now moving on to the next question. Absolute contraindication of IUCD, intrauterine contraceptive devices. What are the absolute contraindication among the following? Anemia, diabetes, PID, or ovarian carcinoma? This is the absolute contraindication. This answer is anemia, diabetes, PID, or ovarian carcinoma. Now we in IUDs, this IUCDs, we have absolute contraindication and limited contraindication. Absolute contraindication means under no circumstance we can use the IUCD in the lady. Relative means in some if some modifications are done or it can be done under some risk factors. So after estimating risk factors, we can increase the IUCD. So what is the absolute contraindication? So you are telling us C, exactly C is the right answer. C is the absolute contraindication. The PID, if the patient is having PID at that moment of time, then we cannot infuse an IUCD. That only. But if the patient is having a history, presently that lady is not having PID, but she has some history of PID, then it becomes a relative contraindication. And anemia, diabetes, ovarian carcinoma is a relative contraindication. Okay? But there are actual contraindications in case of cervical, cervical and endometrial carcinoma. It becomes a actual contraindication. In case of breast cancer, the IUCD LNG cannot be which cannot be the people having breast cancer becomes an absolute contraindication. While ovarian carcinoma is a relative contraindication. Moving on to the next question. Which one of the following is not a measure of dispersion? This is not a measure of dispersion. Mean deviation or standard deviation. So from this chapter, questions are usually rare, but you never know. Maybe asked sometimes. So just have a basic idea about this chapter. Which one of the following is not a measure of dispersion? We need to know what is dispersion and what are the components under that. This is the right answer. Yes, exactly. I'm getting answers like mean. Mean is the right answer. Mean is not a measure of dispersion. This is a measure of central tendency. Central tendency. Range is a measure of dispersion. Mean deviation is also a measure of dispersion. Standard deviation also is a type of dispersion. Moving on to the next question. Prevention of emergence of risk factor is, okay, we're coming back to the similar question of prevention because it is a very important topic in community. Primordial prevention, primary prevention, secondary prevention, or tertiary prevention. This prevention of the emergence of risk factor. Purely, when do we do tertiary? After disease is established. After disease is established, okay. And secondary prevention is done when the person is have just started the disease. Have to see and grade the disease. It might be in the preliminary stage of disease. Primary is after the emergence of risk factors. Risk factors has been emerged in the population. That is when primary is done. Now, primordial prevention is the correct answer here because this is done before the emergence of risk factors. Before the emergence of risk factor. Here we give the health education. We teach the population about the health issues and how they can prevent the emergence of risk factors. Here, this is the right answer. A is the right answer. Some of you have answered correctly. A is the right answer here. Not B. Primary is after the emergence of risk factors. And primordial is before the emergence. So, we prevent the risk factors by doing primordial prevention. Moving on to the next one. All are health promotion strategies except insecticides free, portable safe water supply, lifestyle modification, or chemoprophylaxis. This is not a health promotion strategy. Now, for this, you need to know what is health promotion, when it is done. Health promotion is a kind of what? Kind of primary prevention. Comes under primary prevention. That means after the emergence of risk factor, we are kind of preventing the disease. That is what health promotion does. Preventing the disease. How do we prevent the disease? In case of malaria and all, we have mosquitoes, so we spray these insecticides to kill them. So A does come under health promotion. This cannot be the answer. And now portable safe water supply. That is in case of sewage problem and diarrheal diseases, we supply the safe water. We have a risk factor of getting diseases. So to prevent those diseases, we supply safe water to the population, thereby preventing the direct diseases. So that is also a kind of health promotion strategy. That is not the answer here. Now lifestyle modification in case of diabetes and other coronary artery disease and those kind of diseases where person is having some kind of predisposition to a kind of disease. So we modify the disease. We promote the health of the person by modifying the disease, modifying the lifestyle, thereby preventing the disease. So this also does it's a promote like it is also kind of health promotion strategy. This also can't be the answer. Now chemoprophylaxis. What is chemoprophylaxis? It is a kind of treatment. So B is the right answer. Okay, not the other ones. It's a kind of treatment. Even though the name is prophylaxis, we are treating the patients. So D is the right answer. Now moving on to the next question. Previous question you answer correctly. Now answer this one, please. The following does not determine specific protection. This is not a kind of specific protection. Taxpayer for early detection of cancer cervix of in the community, wearing goggles by welders, wearing seat belts by car drivers, vitamin A for children prophylaxis, which is not a kind of specific protection. It is very much easy because we had just better in previous 5 4 slides that we had benefited. Exactly, I'm already getting answers at A is the right answer. Why? Because this is a kind of early diagnosis. Early diagnosis. Early diagnosis. We are doing task here to diagnose the CA cervix as early as possible. Wearing goggles by vendors is a kind of specific protection. We have a specific cause and we have a specific thing to protect. And wearing seat belt is to protect the car drivers from accidents, specifically from accidents. And vitamin A is to prevent the childhood blindness. That is also a kind of specific protection. Now, all of you have answered correctly, and some of you have answered it very much correctly. A is the right answer. Okay. Now, moving on to the next question, which is not included in primary prevention. Again, the same question is repeated for you to register this in your mind. It is not included in primary prevention, health education, lifestyle modification, immunization, or nutrition supplementation. This is not included in primary prevention. This answer, getting answers as lifestyle modification is done in primary prevention. Primary prevention has the, yeah, exactly. A is the right answer. Health education is the correct option here because health education is done in primordial prevention, not in primary. Primary prevention has health promotion, not health education. Okay. That is why health education is the right answer here. Nutrition supplementation and immunization, everything comes under primary prevention. Why? Because it is a kind of specific nutrition supplementation is kind of specific protection. Specific protection is a strategy. Specific protection is a strategy of primary prevention. And immunization is also a kind of specific protection. And lifestyle also comes under specific protection. It also comes under primary. But health education is the one which comes under primordial. Primary has health promotion. Okay. Moving on to the next question. This answer is one. ICD-10 stands for. The psychological aspect of the SPM, this is asked. It's a very much simple question. We have a book called ICD-10 to read in psychology, right? What is the full form of that? It's an international classification of drugs, international classification of disabilities, or international classification of diseases, or international classification of disasters. Which is the right answer here? It's very much easy and direct question. And there was doubt that lifestyle is primordial. So lifestyle modification is done after there is a emergence of risk factors, right? Yeah, in primordial prevention, what we do is before the emergence of risk factors, we are giving the interventions there. So there, the lifestyle is not modified as such. Lifestyle is taught to the people. The people are educated and taught which lifestyle they have to practice. But in case of primary prevention, what we do is we modify that. In case the person is having a risk factor of developing the coronary artery disease, modify their lifestyle in such a way to prevent the emergence of the disease. That is why lifestyle modification is not the correct answer here. And moreover, and lifestyle modification is a kind of health promotion, not education. Education is from the primary level only. Primary means the base level only. We will try to teach the people what lifestyle they have to follow. And modification is a kind of health promotion. We are promoting the health instead of educating. That is why that is not the answer for this question. Yeah, as all of you have correctly answered, here the right answer is C. C is the right answer here. This international classification of diseases. Nothing much to explain here. Next question. Iceberg phenomenon differentiates what? Apparent and inapparent cases, symptomatic and asymptomatic cases, cases and carriers, diagnosed and undiagnosed cases. This is the right answer here. This answer. Iceberg phenomenon differentiates among what? Apparent, inapparent, or symptomatic, asymptomatic, carriers and cases, or undiagnosed and diagnosed. So, what are these? Apparent, inapparent, symptomatic, asymptomatic, cases and carriers, undiagnosed or diagnosed. This is the most suitable option. Exactly, all of you have correctly answered. A is the right answer. There is a differentiation between apparent and inapparent cases. Inapparent cases will have the asymptomatic cases and also the carriers and the undiagnosed, all of them. That is what the this is. Next one. Moving on to the next question. Seasonal trend. In some diseases we know we have a seasonal trend, right? Why is that seasonal trend occurring? Is it because of vector variation or because of environmental factors or because of some change in the herd immunity or all of the above? Which is the right answer here? This answer is very much easy. Yeah. Also the answer says D. Exactly. D is the right answer. Seasonal trend is because of all of this. It can be either because of vector variation or because of some environmental factors or in case of herd immunity. That is why there is seasonal trend in certain diseases. Nothing much to explain in this one. We move on to the next question. Okay. All of the statements about quarantine are true except now in the present scenario, quarantine term is very much easy to for us to understand, and it is very much used in nowadays. So, which is the wrong statement? This is the wrong statement among the four of the following. It is synonymous with isolation. Absolute quarantine is restriction during incubation period. Exclusion of children from school is an example for modified quarantine. And the last one, quarantine should not be longer than the longest incubation period. Which is the right answer? Yeah, I'm always getting answers as A. A is exactly the right answer. Quarantine is done for whom? For the healthy subjects. Healthy people may or may not be having the pathogenic agent, means they are asymptomatic anyways. But isolation is done for the people who have the disease. These are two separate terms. That is why this is different. So A is the right answer. Other things are absolutely true because absolute quarantine is restriction during the incubation period, and this exclusion of children from school, it is a kind of modified quarantine. And also quarantine should not be longer than the longest incubation. Quarantine should not be longer than the longest incubation period. That is why for corona they were telling quarantine for minimum 14 days. No, minimum 7 days, but 14 days can be extended. That is it. Now moving on to the next question. Global eradication of smallpox was done on which of the following? 26th October 1977, 8th May 1980, 17th March 1980, or 17th April 1977. This is the right option here. See, in SPM, there are certain things which certain dates you need to know. That is about the Act, ESI Act, Labels, the Factories Act, and all those things when it was when it was when it came into thing, and also about the global eradication of smallpox. That is another important date which can be asked. Exactly, I already got the answer as B. 8th May 1980 is the right answer. There is no significance to the other dates. 8th May 1980 is the day when smallpox was declared as eradicated from the world. Now moving on to the next question. Primary prevention of obesity. Primary prevention of obesity. What is the? So we know for preventing obesity, the doctors, that is we ourselves, we give some or the other modification of the diet, which is the primary prevention of obesity here. Answer: the low fiber diet, high cholesterol food, or high intake of protein. Which is the right answer? Exactly, I got the answer already. It is B. B. High fiber diet is the one which is advised for preventing obesity. High fiber diet. High cholesterol, obviously, it is not high intake of protein, is also not advised. Low fiber diet is also not advised for preventing obesity. Moving on to the next question. Target group in secondary prevention. Who are the target group in secondary prevention? Individuals, patients, animals, or children. Remember one thing. Yeah, this answer. Remember one thing. In primary and primordial prevention, we have target group as the healthy individuals because they do not have a disease yet. The primary people have the risk factors, positive people, and primordial are risk negative. They are mostly the children, mostly the children, and they are healthy. But in secondary prevention and the tertiary, we have the people who already have a disease, already have the disease. They are the target group. That is why here, right answer, as you all have correctly said, it is B. Patients are the target group. Okay. Moving on to the next question. Decrease in the incidence of a disease to a level where it ceases to be a public health problem is control, elimination, eradication, or surveillance. Which is the right answer? Decrease in the incidence of a disease to a level where it ceases to be a public health problem. Control, elimination, eradication, or surveillance. Now, this can be understood pretty much easily in the present situation. Nowadays, we are locked down to do what? To eliminate corona or eradicate corona, to control corona, or to just have a surveillance over the disease. Start giving the answers. It is control. So we are trying to control the incidence. We are trying to control the incidence of the disease. Now, in the present scenario, COVID has become a public health problem. So, to do that, we are doing something to decrease the incidence. To do that, we are controlling, we are trying to control it. That is the meaning of the definition of control. And eradication, elimination comes later. After controlling, only elimination comes. Is decreasing the prevalence. Prevalence is what elimination means. Eradication is completely, entirely, we are um, like washing out whatever is there, whatever pathogenic agent is there in the community, we are eradicating it. That is what happened to smallpox. Okay. Now moving on to the next one. Disease eradicated from the world. Which among the following has been eradicated from the world? Remember, it is from the world. Is it smallpox? It is guinea worm? Is it polio? Is it diphtheria or is it measles? Remember, it is from the world. Okay, the world. Is it smallpox? It is guinea worm? Is it polio or diphtheria or measles? Exactly, I got the answer. It is smallpox. Smallpox is the one which is eradicated. 8th May 1970. Moving on to the next question. Now, in this question, we will have more than one answers. Okay, remember that. And now, please answer the question, please. Candidates for global eradication by WHO. Which among the following is the candidate for global eradication? Is it malaria, dracunculosis, polio, measles, or chickenpox? Which are the candidates for the global eradication? Or global eradication by WHO. Which is the and which are the candidates? There can be more than one answer. Please remember. I'm getting answers like B and C. Any other answers? Exactly. B and C is the answer. B and C. There is one more. B and C is the answer. Tuberculosis and polio are the candidates. There is one more. That is measles. Measles is also a candidate for global eradication of WHO. That is why WHO has been forming strategies in various countries to eradicate the disease. In India, it has been polio. Nowadays, polio control program, pulse polio program is being conducted to entirely eradicate polio in India. Now, moving on to the next question. Yeah, disease eliminated from India. Please, again, we'll have more than one answer here. Please answer this one. Disease eliminated from India. India, our answer is a smallpox. Is it Indian disease? Is it yours, leprosy, and neonatal tetanus? Is it measles or is it polio? The right answer here. Please answer. Smallpox, we already learned it is entirely eliminated from the world. So this is included. A becomes an answer. Guinea worm disease. Guinea worm disease, I'll tell you, Guinea worm disease has been eradicated, has been eliminated from India. Okay. So B is also an answer. Yaws, leprosy, and neonatal illness. It also, according to WHO, it has been eliminated, even though nowadays there are some cases of leprosy here and there, but still, according to the textbooks, it is also considered as eliminated. So A, B, and C are the answers, and measles and polio are trying to be eliminated. That is why A, B, and C is the answer. Polio is not yet eliminated actually. These are mean dates. Even though some literatures do say that polio has been eliminated, but according to the recent reports, polio has not yet been declared eliminated. Moving on to the next question. All of the following are eradicable disease. Eradicable disease except, remember, which cannot be eradicated. TB, guinea, polio, or measles, which cannot be eradicated. Please answer. Which of the following cannot be eradicated? Is it TB, guinea, polio, or measles? We all know guinea worm is already eradicated in India, so this cannot be the answer. Poliomyelitis is trying to be eliminated from India, so this also can't be answered. Measles also is a candidate for elimination, eradication by WHO. This also can't be the answer. TB is one such disease which cannot be eradicated. There's a term that TB is one disease which cannot be prevented, but it can be cured. AIDS is the one, it used to be, now AIDS also can be cured. AIDS is the one which cannot be cured but prevented. There used to be a saying that goes like that. So TB is the one which cannot be eradicated. Yeah, I second like that. Now moving on to the next one. In India, which disease is near to elimination? Similar question. Easy to answer. In India, which disease is near to elimination? Is it tetanus, rabies, polio, or mumps? This is the answer. There are 10 more questions. After that, we'll wind up today's session. So please stay with me till then. This is the answer here. In India, which disease is near to elimination? Exactly, I've also added the answers. As C is polio is the one which is near to elimination. Okay. Now moving on to the next question. In South India, pellagra is reported in the population eating what? Ragi, jowar, bajra, and millets. Which is the right answer here? In South India, pellagra is reported in population eating what? This is a recent survey and report, so you need to be updated with the recent things also a little bit at least. Whenever we listen to, whenever we hear the term as pellagra, we directly go for maize, right? But here in South India, there was a recent report saying that in Jowar population, the people who are having more of Jowar, they are having pellagra. So right answer here is B, okay, not D or C. Maize is a kind of millet, right? This is a common mistake which people can make. In South India, if the question is like South India, then Jowar is the one. Why? Because Jowar has leucine and isoleucine in high amount. That affects the niacin metabolism. That is why pellagra happens in the Joe population in South India. That is why B is the answer here, not C. Not C. Moving on to the next question. Which is the first and commonest clinical manifestation of epidemic dropsy? Is it bilateral swelling of legs? Is it gastrointestinal abscess? Is it cardiac decomposition or sarcoid? Which is the right answer here? Which is the first and commonest clinical manifestation of epidemic dropsy? Bilateral swelling of legs? Is it gastrointestinal abscess? Is it cardiac decomposition or sarcoid? I've already started getting answers as A. Exactly. A is the right answer. As the name suggests, it is dropsy. So anything related to swelling. So bilateral swelling of legs is in fact the first. This is the first and commonest clinical finding in epidemic dropsy. One more thing about epidemic dropsy is because of Argimo mexicana. Right? Argimo mexicana seeds. Moving on, move on to the next one. All of the following are used to assess the nutritional status of an individual except what? Primary nitrogen excretion or mid-arm circumference, serum immunoglobulin or serum transfer, which is used to assess the nutritional status of an individual. Sorry, which is not used. That is the question. What's the right answer here? Urinary nitrogen excretion or mid-arm circumference, serum immunoglobulin or serum transfer. They have started getting answers as B or C. The right answer here is C. Mid-arm circumference we have studied in the cold energy malnutrition. While studying that, we have a score for mid-arm circumference, right? So this is not the right answer. C is the right answer. C is not used. In urinary nitrogen excretion, we use this versus the protein content of the food, content of the diet, how much protein the person is having. So that is also used. And serum transferrin we use iron content, absorption iron content of the person. So C is the right answer here. Santosh, yes. You have correctly answered it. Remember, it has been asked except. Yeah. Next question. Besides 3 Ds, we have niacin deficiency, that is in Pellet, we have 4 Ds, right? Which is the fourth D? That is the question. First D is diarrhea, then dementia, then dermatitis, then dementia. Which is the fourth D? Very much easy question. Which is the fourth D? Is it destruction or death or debilitating or disability? Right answer here. This answer very much easy question because we have been studying Pellegraph based on this mnemonic only. 4 days. What doubt? Please ask in the chat box and answer it. How many of you answered correctly as death is the right answer? Exactly. E is the right answer. Moving on. Next question. A is the right answer here. The fourth B is death. Diarrhea, dementia, dermatitis, and death. Huh? A man belonging to a poor community presents with diarrhea and dermatitis. He also shows signs of personality and memory dysfunction. His history suggests that his staple diet is maize. Likely diagnosis is post-op psychosis, vitamin B12 deficiency, pellagra, riboflavin deficiency. What is the right answer here? It is very much easy question. You can answer it very much easily because just in the previous slide we were dealing with it. The person, see this application kind of questions which is ought to come. Questions will come in the future exams because nowadays they are the examiners are more interested in your application knowledge. They will give a case like this. Here we have a person who is poor and who has diarrhea, dementia, and has personality and memory dysfunction. Diarrhea, dermatitis. Memory dysfunction is dementia. You can take it as dementia. And one more clue they have given that his staple diet is maize. We know in maize eating population what is more prevalent? Niacin deficiency. And niacin deficiency causes what? It causes pellagra. So right answer, as you all have correctly answered, it is C. Pellagra is the right answer. Okay. Now moving on to the next question. All are true statements regarding BCG vaccination except this was there in the previous questions. Same question is repeated here. Please answer it first. Please answer it first because it's very much easy. This is not true about BCG vaccination. Given subcutaneously can be given in tuberculin infections, prevent hematologic spread. The pattern Mycobacterium both. Exactly, I already got the answers. It is A. Why? Because BCG vaccination is given intradermally. Okay, not subcutaneously. There's difference between intradermal and subcutaneous. So moving on. The minimum gap that should be allowed in between to administer two live vaccines. You already know that we cannot give two live vaccines together. We cannot give two live vaccines together. So there has to be a gap between the two vaccines. So how much gap should it be? What is the gap? Is it 2 weeks or is it 4 weeks or is it 2 months or 4 months? What is the right answer here? What is the right answer here? Is it 2 weeks, 4 weeks, 2 months or 4 months? Different answers. So remember one thing. The minimum gap between two live vaccines should be 4 weeks. Dr. Ravi has answered it correctly. And Dr. Chan, the right answer is I and many of you answered correctly. The right answer is 4 weeks. 4 weeks is the right answer. The minimum gap should be 4 weeks. Okay, remember that. This is important for your general knowledge also. Some patients might. Next one. So there is a vaccine called TY21A. What is the vaccine for? Is it for typhoid? Or is it for hepatitis or for rotavirus? Very easy question. Please answer it. TY21A is the vaccine of what? Typhoid, cholera, hepatitis, or rotavirus. As the name suggests, TY means typhoid. Exactly. Typhoid is the right answer. Typhoid is the correct option here. TY21A is a kind of vaccine for typhoid. Okay, remember. Now, moving on to the next question. Nosocomial infections are those which develop within 24 hours of hospitalization, then 48 hours of hospitalization, then after 48 hours of hospitalization, or after 7 days of hospitalization. Right answer. Now we all know it's nosocomial infection. And the question asked is, when does it occur? When do we say that infection is a nosocomial? This is the right answer. All are saying that C is the right answer. Yes, some have different opinion also. The correct option is B. Remember, sorry, not B. The correct option is C. After 48 hours, if a person develops a disease after 48 hours of hospitalization, then the person is said to have nosocomial infection. Within 48 or within 24 hours, then it is not considered as nosocomial. If it is after 48 hours, then it comes under nosocomial infection. Remember that. C is the right option here. Some of you have answered correctly. Dr. Chandni, Dr. Saransh. Many of you answered correctly. Moving on to the last question. This will be our last question for the community medicine discussion. Disinfection of urine is which kind of disinfection? Not the last question. There's two more questions. Disinfection of urine is which kind of disinfection? Is it percurrent or concurrent or recurrent or terminal? Which is a kind of, this is for disinfection of urine. To know this, we need to know what is recurrent, concurrent, terminal or percurrent disinfection. Answers are this. Remember, there is nothing called percurrent. There is recurrent. Okay. Current, there is nothing. There is recurrent, but there is nothing called percurrent. Now, concurrent disinfection is the right answer here. Okay, concurrent B is the right answer. Silpa has answered it correctly. B is the right answer. Okay, B is the right answer. Disinfection of urine is coming under concurrent disinfection. Now, concurrent disinfection is something. And just after, for example, a person is admitted in the hospital and he is unable to pass urine in the toilet, and he is being given a pan to pass the urine. And in that case, the person is infected and that means discharge, urine is a kind of discharge, right? Elimination. So that material is coming out of the body of the infected person. As soon as it comes out, it is given for disinfection. That kind of disinfection is called as concurrent. The person is there and throughout his stay in the hospital, whatever his discharge, the sputum or nasal discharge or any pus or urine or his clothes or his feces or even if his vomitus or any dressings or even if someone who is attending him and their gloves. Those things are given for disinfection. That is coming under concurrent disinfection. Okay, so that comes under concurrent disinfection. Yeah, I will explain all the four options. So, concurrent means the definition goes like disinfection after the discharge of the infectious material from the body. The urine, the clothes, the apron, the feces, the vomitus, the dressings of the patient, the gloves of the attendant, whichever has come in contact with the patient when he is infected, that comes under Concurrent. Okay, that comes under concurrent. There's one more thing called terminal. Terminal means after the person has been discharged, or after the person has dead. Is after the person has dead. If the person has area or the room which he stayed or the clothes which he had worn, that is being disinfected. If that is being disinfected, that is called terminal. It's the last one, terminal. After the person has died, or after the person has stopped being a after the person has stopped being a source of infection. Either the person has recovered or the person has, that is called terminal. And there's something called recurrent. Recurrent or recurrent, it means it's a prophylactic thing. The infection is prevalent in the area, and to prevent getting the disease, we do some things like chlorination of water. Now for corona, we are doing hand sanitization, hand washing, and pasteurization of milk, all those things. Where we prevent, we have a prophylactic measure, prevent the spread, or even if there is no infective agent in the area, I'll give a break. There will be two more questions and we will be done with the session. Okay, so you don't have to worry. Uh, yeah, so yeah, that is what pre-concurrent means. Prophylactic, chlorination, pasteurization, and washing. That comes under pre-concurrent. Now moving on to the next question. Disinfectant. Disinfectant is also an important thing. You just have to read about it. Disinfectant is one which kills the bacteria and spores. Kills bacteria only. Kills spores only. Or kills viruses also. What is disinfection? Please answer it. It's very much easy. You have read about disinfections, disinfection and sterilization, right? In SPM and microbiology while reading it. So what is disinfectant? Remember, disinfectant kills the bacteria, that is true. But it does not kill the spore. Okay? Spore can be deactivated by using some more other technique, but it does not kill the spores. So here the right answer is B. B is the right answer. Okay. B is the right answer, not A. Spores are not killed by bacteria. Sorry. Not killed by disinfectant. Disinfectant. It is killed by sterilization. Autoclaving, all those things are done for killing the spores. Now, disinfectant is the one which is used to kill the bacteria. Sai and Dr. Anu has answered it correctly. Moving on to the next and the last question. With this, we'll end the community medicine MCQ discussion. Yeah, Mission Indradhanush does not include right option. Tetanus, measles, meningococcal meningitis, or Japanese encephalitis. What is the right answer here? What is the right answer here? Mission Indradhanush. Mission Indradhanush. Please answer. Are you waiting? With this, we will finish our MCQ discussion of community medicine. If you have any doubts, you can ask now. Else you can message in the group or directly. And yeah, I've got the answers as C, A, etc. Now, before going into the answer, I'll just explain about Indradhanush. Indradhanush, as the name suggests, what is it? Means rainbow. The rainbow has how many colors? 7 colors, right? So there will be 7 basic vaccines. 7 vaccine preventable diseases under Mission Indradhanush. That is basic ones. Okay. Which are they? They are diphtheria, pertussis, tetanus, then TB, then polio, then hepatitis B, and then as measles. This is also. So this was the basic ones which was suggested when the Mission Indrahanush was proposed in the. So it was established in 25th December 2014. So this was the basic system. Then after that, after 2 years, it was modified. Along with these basic 7 diseases, four more diseases were included. Four more diseases were included. Actually, 3 more diseases, only one more form of vaccine was included. One is Japanese encephalitis, then rubella, then came was rotavirus. These rotavirus, one more thing was IPV was also included. Polio was known as OPV, the first proposition, but later IPV was also included. Smallpox was also included. So according to this thing, now you can easily answer, and as majority of you have answered correctly, C is the right answer. Tetanus is included. Tetanus is so DPT, DTB, polio, hepatitis B, measles, Japanese encephalitis, rubella, and rotavirus is included under Mission Indrahanush. The right answer is C. With this, we finish the session. And before going into that, one small mnemonic for you to remember the mnemonic for soft tick. I told it yesterday also, just brushing it up once again for you because this in the recent years this has been asked in many other PG exams. So yeah, mnemonic for spread by soft tick. Small distance, soft relapse of flu fever at kids. So KFC again start with soft. Soft means soft tick, means soft tick as relapsing fever, flu fever, and Carson's forest disease. All these have soft tick. Just a remember for the memories. You can make your own memories for the exams. For the vector portions, also you have to understand. And yeah, that's it with the session for today. Any doubts you can ask now, or else you can message us in the group or personally message them. And I will forward it to you. I'll try to answer as much as possible. Then other than that, the things you need to study in SVM for sure is the vaccine portion, the vectors, the vitamins, then prevention chapter. Yeah, those are the most important one. And occupational diseases, all those things. Thank you for participation, everyone. All of you have correctly answered, and some of you, even though the answers were wrong, you have participated. If you make mistakes now, you will be not making mistakes in the exam. So that is a good thing. Making mistakes now is fine. And any more doubts or anything, you can ask now. And if not, I will end the session today. And thank you. Good night, everyone, and stay safe. And you all are healthy and remain healthy. Prepare well, and thank you. Good night.